I'm Abdrabba, and today we will talk about the cardiac cycle. If you open any physiology, cardiology, even pharmacology books, you will find this diagram. This complex diagram made nightmares for some students. However, we will try to simplify it in this small video. So what is the cardiac cycle? It is a cycle. What does it mean? It means it is repetitive. With every heartbeat, we get two major phases, which are systole and diastole. Okay, so the cardiac cycle is made of two large phases, which is systole and diastole. However, the thing is not that simple. If you can see, the systole is divided into phases, and the diastole also is divided into phases. So let us understand what does this mean, and what does this diagram correlate with. In this diagram, you will find at this side the pressure in different chambers. So this is the left ventricle, this is the right ventricle, this is the pulmonary artery, and this is the aorta. So what does this mean? This means that in the cardiac cycle, when the cardiac motion is plotted with time on this axis and pressure on this axis, you get different pressure waves on different chambers. So let us go with it. In the beginning, you get the pre-systole, what we call the atrial systole. In this last part of the diastole, what do we get? We get the atrial kick. The atrium contracts while the pressure of the left ventricle, which is in purple, is near 0. The aortic pressure is near 80. This is the diastolic pressure. The event of atrial systole kicks the remaining blood into the ventricle. After that, the pressure rises in the ventricle, which is isovolumetric contraction. What happens in isovolumetric contraction? After the mitral closes, the aortic valve is still closed and the pressure rises in the ventricle against a closed chamber. What does it mean? It is like that you have closed a very closed chamber, which is contracting, which is getting smaller in volume. This means that the pressure is elevated. And here the name isovolumetric. This means a stable volume. It doesn't change. This allows the ventricular pressure to get up and become higher than the diastolic pressure of the aorta. So it opens the aortic valve. Yes, that's true. Then the pressure of the ventricle and the aortic valve early in systole gets higher. This allows the blood in the ventricles to be pushed into the aorta. So here comes the systole. There is an early phase of systole and a late phase of the systole. So these are 4 phases. Then after that, the pressure in the ventricle goes down and the aortic valve closes here and the mitral valve is still closed. So when both valves are closed, this means that we have the isovolumetric relaxation. So when the changes occur with a stable volume, an unchanging volume against closed situations, the pressure changes steeply, as we can see in these phases, both the isovolumetric contraction and the isovolumetric relaxation. After that, what happens? The pressure in the ventricle goes downward until it becomes lower than the atrial pressure. This is the atrial pressure in orange, and when the pressure in the ventricle meets this, the AV valves, which includes the mitral and the tricuspid valves, starts to open, and when they open, the diastole begins and the blood flows from the left atrium to the left ventricle. And when the pressure gets higher and blood accumulates in the ventricle, the atrial kick gets again and gives us the last push before going to the systole. This is the cardiac cycle, and then the process repeats and repeats. So what is the remaining part of this diagram? The remaining part of this diagram is the ECG. Usually, it is not usually, it is the fact, in fact, that the P wave, which is the depolarization of the atria, occurs first, then it leads to contraction of the atria, then the QRS complex, which reflects the depolarization of the ventricle, leads to the systole, then the T waves precedes the electrical phenomena precedes the mechanical phenomena. Then in this electrical silent phase occurs the diastole, and it repeats again and again. Again, the last part of this diagram is the plot of the heart sound. As you know, the first heart sound occurs with the closure of the mitral. Here closes the AV valves. Then the second heart sound occurs with, the closure of the semilunar valves, which is the aorta and the pulmonary valve. The third and the fourth are related to the filling. The early part of the filling is concordant with S3 when there is a disease, and S4, which is concordant with the atrial filling, and it also occurs when there is significant diastolic function also. It is important to remember that at heart rate of 75, the cardiac cycle will last about 0.8 seconds, with 0.3 seconds in systole and 0.5 seconds in diastole. This means that whenever we go higher in heart rate, the systole remains a little bit fixed. It doesn't shorten too much. What shortens much is the diastole. This has clinical implication in the use of beta blockers in reducing the cardiac work and in improving symptoms in ischemia and in heart failure. Thank you.